In podcast number 75, Steve and I spoke with Shrey Vazir, an advanced physiotherapist and founder of Mind-Body Horizons. His work focuses on integrating mindfulness into physiotherapy and healthcare to help individuals manage chronic pain, stress, and burnout. During our discussion, Shrey shared his journey into mindfulness and its intersection with physiotherapy, as well as providing us with valuable insights into how we, as healthcare professionals, can apply these principles to benefit both patients and ourselves. Shrey's path into mindfulness began with his own personal struggles. At 21, he experienced severe back pain that led to a fibromyalgia diagnosis. Frustrated and searching for answers, he underwent extensive medical testing, but no structural issues were found. Initially skeptical of non-traditional approaches, he was introduced to mindfulness while studying kinesiology. Though he dismissed it at first, emerging research on central sensitization and nociplastic pain caught his attention, prompting him to explore how pain was not solely a physical experience, but deeply connected to the mind. This shift in perspective led him to integrate mindfulness into his own pain management. Exercise played a key role in his recovery, and he embraced the concept of the hurt versus harm principle. Encouraged by the improvements he experienced, he pursued further training in mindfulness-based chronic pain management at the University of Toronto and Harvard Medical School. This journey led him to founding Mind-Body Horizons, a mindfulness learning space for both patients and healthcare professionals in order to bridge the gap between physical and mental well-being. Shrey argued that traditional physiotherapy often focuses too heavily on the biomechanical model of pain, neglecting psychological and emotional factors. He believes that mindfulness fills this gap in both patient care and clinician well-being. As healthcare providers, failing to address our own mental health contributes to burnout and reduced effectiveness in patient interactions. To define what mindfulness is, Shrey referenced Dr. John Kabat-Zinn, who described it as the awareness that arises from paying attention on purpose in the present moment, non-judgmentally. Shrey emphasized that mindfulness was not about achieving calm, but about cultivating awareness and acceptance of thoughts and emotions. We also discussed how chronic stress affects both the mind and body. Shrey explained that while stress itself is not harmful, unchecked, chronic stress creates a negative cycle of automatic negative thoughts, heightened emotions, maladaptive behaviors, and therefore increased physical symptoms. Mindfulness helps to interrupt the cycle by increasing our awareness of our thoughts and reactions, allowing individuals to break free from harmful patterns. We also talked about practical applications of mindfulness in physiotherapy, where Shrey outlined a stepwise approach. First, practitioners should acknowledge that physiotherapy involves treating the whole person, not just their physical symptoms. He recommended simple breathing exercises like diaphragmatic breathing or 4-7-8 breathing to introduce patients to mindfulness in an easily accessible way. Over time, these techniques can progress into guided meditation using apps like Headspace or Calm. For anyone wanting to know more, Shrey recommended structured mindfulness programs such as mindfulness-based stress reduction. Mindfulness is also valuable for preventing burnout in healthcare professionals. Shrey highlighted the STOP technique, which involves pausing between patient sessions for a reset. The S in STOP is for stop what you are doing. T, take 3 deep breaths. O, observe your thoughts and emotions without judgment. And P, proceed mindfully. He also encouraged mindful eating as a simple way to incorporate mindfulness into daily life, emphasizing the importance of taking time to focus on the act of eating without distracting ourselves, for example, by scrolling on our smartphones. Addressing misconceptions, Shrey debunked the myth that mindfulness requires clearing your mind of all thoughts. Instead, he described mindfulness as the practice of observing thoughts without attachment and gently bringing focus back to a chosen anchor, such as breathing. He likened it to a mental biceps curl. Each time the mind wanders and then returns to focus on the present moment, it strengthens one's ability to stay present. Shrey shared success stories where mindfulness transformed patients' experiences with pain. One case involved a woman with complex regional pain syndrome in her hand. Through guided meditation and body scan techniques, she gradually reconnected with her affected limb, realizing that much of her pain stemmed from emotional and cognitive responses rather than purely physical damage. Over time, she regained function and returned to work. Reflecting on his personal journey, Shrey explained how mindfulness had transformed his struggles with anxiety, stress, and chronic pain. He described movement-based mindfulness practices as an alternative to seated meditation, focusing on body awareness and relaxation without judgment. Unlike structured exercise routines, mindfulness focuses on being present in the sensations rather than achieving specific physical goals. Towards the end of our conversation, we asked Shrey for book recommendations. He suggested some works by Jon Kabat-Zinn, though he acknowledged their complexity and also recommended some books by the founder of the Headspace app, Andy Puddicombe, for a more accessible introduction. Additionally, he highlighted writings by Thich Nhat Hanh, a Vietnamese monk known for making mindfulness teaching more approachable for beginners. In closing, Shrey shared one of his favorite quotes by Jon Kabat-Zinn. "You can't stop the waves, but you can learn to surf." He believes this encapsulates the essence of mindfulness. Not eliminating life's challenges, but learning to navigate them with awareness and resilience. All right, guys, this was a brief summary of podcast episode 75 on mindfulness with Shrey Vazir. I hope this made you curious to listen to the whole episode, and if you'd like access to more resources, download the Physiotutors app to listen to the podcast episode in your own language, and also get access to the transcript and infographic if you become a premium member. As always, thanks a lot for watching, and we'll see you in another video. Bye.